Hello, my name is Taquana Holly. I am a student at the University of Arizona Global Campus in their Masters of Public Health program. I am here tonight to present to you a novel intervention called MTalk. It's a mobile application for African Americans regarding heart disease and the development of communication strategies to facilitate decreasing the number of heart disease cases. First, I want to talk to you about the scope of the problem. Heart disease is one of the most prevalent burden of diseases affecting the United States. Healthcare costs associated with heart disease has been estimated up to $3 trillion. Despite the advancements in services and technologies and other healthcare modalities, the rate of heart disease continues to increase. Yet there is a drastic difference in the rate of heart disease among the different racial and ethnic groups. The CDC noted that African Americans have a higher rate of heart disease than Caucasians. African Americans are 30% more likely to die from complications associated with heart disease than whites. And African Americans have been noted to be developing risk factors for heart disease at a younger age at an increased rate compared to other ethnic and racial groups. There has been a noted increase in the number of mortality and morbidity in African Americans associated with heart disease. A lot of information is linking this to the social and biological determinants of health. When we explore what has been done through an examination of the research, we note that there has been a multitude of research done exploring factors that increase the rate of heart disease among African Americans. Research has examined the effects of prejudice, racism, and discrimination within healthcare and its effects on patient outcomes. Other research has focused on the perception of health and effective health management, exploring the social constructs that influence individual behavior. There has also been some research on various technology and technological platforms that can be used to facilitate better health outcomes, such as telehealth or telemedicine. A large portion of the research focuses on external factors that contribute to segmented healthcare in the United States. There has been a strong examination on the social determinants of health on the outcomes of African Americans, especially as it relates to accessibility of services and coverage for health services. Yet none of the research focuses directly on communication and its effect on healthcare management when it comes to African Americans. When we examine the research more closely to find out what worked and what didn't work, we see that some of the weaknesses in the research is how the interventions were effectively implemented. There has also been a lack of community involvement, and there is no consideration of the cultural norms that affect African Americans. Moreover, a lot of the research focuses on small sample sizes, which limits the ability of the research to be generalized to larger audiences and more targeted segments of African Americans. Yet on the flip side, the strength is that it does explore the racial undertones in healthcare, and it pays close recognition to the fact that there is a problem. There is an issue when it comes to heart disease among African Americans. There has been a strong push in the research to explore the biological risk factors. What other underlying health conditions do influence the development of heart disease among this specific segment of the population? More and more, we're exploring the use of technology and innovation in practice and how it can be applied to healthcare, especially when it focuses on the healthcare of African Americans. So what am I proposing? What am I thinking of? Let's talk about it. The novel intervention I am thinking about using is the development of a mobile app. The goal of this intervention is to combat heart disease among African Americans through effective health communication. The proposed intervention uses a mobile app that can be used to meet the needs of multiple learners and learning styles. The intervention utilizes technology and innovation for behavioral modeling and knowledge acquisition. The mobile app as an intervention allows for various behavioral strategies to be integrated. The proposed application can be utilized on an individual level or communal level to develop different strategies that influence behaviors in healthcare settings that allow consumers to navigate through the system using effective communication strategy. We are going to focus on developing a number of strategies that can be used among all different ages and all different learners. It is important to note that there are a lot of different programs that actually avail themselves to individuals obtaining mobile devices. Hence, we want to try and link people with the services that are readily available so they can start to use this novel intervention. How is the intervention going to be developed? Well, what we're going to use different education sessions that presents information on different topics such as communication, risk factors for heart disease, developing an understanding of the signs and symptoms for heart disease. We're also going to integrate the social determinants of health and the biological determinants of health to help individuals understand the connection between those three entities in the development of heart disease. But we also want to have people empowered and more self-aware. So we're going to develop in the novel intervention embedded in the app self-monitoring and self-tracking strategies. This allows individuals to take ownership of their own health. We're going to create text messaging services where individuals get daily reminders on different health topics as well as different methodologies to communicate in all type of healthcare settings. There will be imposed in the intervention video vignettes that individuals can click on inside the app that will model different type of behaviors such as how to interact with doctors, how to interact with nurses, how to interact with individuals when discussing healthcare topics that may be sensitive. There will also be methods of awareness where you learn to develop an understanding of what exactly the impact of heart disease is on our community. When I was thinking about developing this intervention, I decided to use the social cognitive theory to help me guide the process. This theory was selected because it explores the relationship of the person, behavior, and the environment. Previous research has recognized that there is a close connection between the person, the environment, and the behavior. It considers the influence of the social and biological determinants of health and their influence on behavioral change. It also considers the internal and external mechanisms for behavioral change. We recognize that the environment closely impacts the person, and when it impacts the person, it develops into behavioral manifestations. So what we try to do through the integration of the social cognitive theory is to approach this intervention with the idea of self-directed activities to elicit behavioral changes through reflection, motivation, and tracking. We develop the education program to help increase knowledge acquisition and self-efficacy, where individuals feel empowered to learn more about their health and take control of their health care needs. It helps improve health management, health perception, and also creates an environment of self-reflection and self-motivation where you now become your own advocate and you now understand the factors that influence your own personal health care. We also look for the connection between the environment. What are those social determinants of health that allow the increase in the prevalence of heart disease among the African Americans, especially when it comes to their community? Is it the lack of space to enjoy physical activity? Is it the lack of fresh foods and organic materials? Or is it just the lack of access to healthcare programs or the long waits at clinics that a lot of us have to go to get healthcare services because we don't have health coverage? When we were putting together the whole entire piece for the development of this novel intervention, we used a logic model. This allowed us to think about the actions that we wanted to implement. These actions required us to explore, what do I want my audience to do? What do I want my targeted population to get from this intervention? Well, what we wanted to do is increase education. You won't know how to fight something unless you know what it does. Then we want to have individuals understand the policies. Policies affect our outcomes. If we're not integrated in a political system, we cannot effectively determine change. Then we have to learn about what determines health. What are those factors that are in our environment, in our culture, in our social norms that influence where we are? The overall goal is to improve communication, develop self-advocacy, and increase healthy choices. We want to reduce mortality, morbidity, decrease health disparities, and reduce racial disparities that are prevalent in healthcare. How do we get this intervention into action? That's why I'm here. I'm here to call upon you to facilitate the use of this intervention where the community is actively involved in the project and its planning. Community involvement in the phases of development helps to increase motivation and engagement. It creates a shared decision making and presents the perspectives of the community and targeted audience to the researcher. It allows for a mutual exchange of ideas and facilitates the development of positive relationships. It also helps develop communication and helps pattern behaviors learned through the app into practice. The app is designed to be used on an individual community basis. It can be used to facilitate dialogue among peers and healthcare providers. The idea is to teach children at a young age how to communicate with providers and be their own advocate. It poses strategies for modeling communication and developing an understanding of policies that affect healthcare outcomes of the community as a whole and as an individual. By exposing children to policies that affect their health, the goal is to help them become more active participants in the political process, to facilitate change in policies and learn strategies to impact healthcare communication on a grand scale. If we start at a young age, we can get our children to pattern behaviors that will now become a generational process where they start to teach their children when they get older. The goal is to develop collaboration. How do we want this to work? How do we want to get this information out? How are we going to make this something successful and get this intervention to be successful? We're going to develop partnerships across all different scales. We want to focus on developing partnerships with the school board, with our faith-based organizations, with local politicians, with the healthcare organizations within the community, community-based service providers, and the Department of Health. This will allow linkages to the community on all different levels and all different perspectives, where we're looking at the micro level, which involves the individual within the context of their family structure, as well as the school structure. But then we're branching out and looking at the exosystem, where we're exploring the effects of politics has on the overall health of the community. With that being said, I would like for you to consider taking part in the development and the implementation of this new novel intervention called mTalk, a mobile app to help increase knowledge and awareness of healthcare communication among African Americans, with the goal to improve and reduce the number of heart disease cases within our community. Does anybody have any questions? I want to thank everybody for taking the time out to listen. I appreciate you. Thank you.